over the last 30 years, I've noticed big changes in the system, both in the way the system works and also the expectations of patients. However, the research about patient expectations isn't as clear as people always think. People think expectations have changed, patients are more demanding. Actually, that's not what the evidence shows. It does show that patients are more, have got more information. They've got the internet. They've got they are much more willing, if you like, to question what the doctor's saying because they've done some research. And in many cases now, patients with chronic diseases are experts in their own right. So that has changed. However, the expectation thing, surprisingly, is driven by the health professional very often. There's very much more that we can do. There are many more tests that we can order, and very often it is the health professional themselves driving the process forward. So yes, the patients do come with slightly more demands, but I think I still feel the basic consultation is not very different than it was 30 years ago. The change has been around the societal change to involve patients in their own health care, and particularly for shared decision making. And I think that has changed the skill set that doctors need to have. Paternalism is unlikely to work nowadays. Sometimes patients do want to be told exactly what to do. Again, it's being flexible. As a health professional, what I've noticed over the years is you have to find out where the patient's coming from. Some patients want to have your advice and to run with it. Many patients, in fact most patients, want to have a negotiation around it, at least to hear what the options and choices are. And that's a new skill set to be learned.